What can we put in place to really support patients without tipping that balance and having unintended harm to the healthcare providers?
And it is people in rural and remote areas that have so many additional challenges, and any tool that can be deployed to support health in these rural communities is vital.
Every journey is different. You've got the cancer journey, you've got seniors going someplace, you've got pregnancies, but there's a common theme that goes through is the information doesn't follow, and providers don't have all the information, so they can't do great care if you're missing big chunks of the data. And patients don't have their own data to give to the providers because they don't have access to it.
These are my notes just regarding my health, and I consider myself to be a pretty healthy, robust individual. So I have a comparable file for each of my children as they were growing up, not as large as that because they're younger than me. I've been around for 71 years. To get those records took tenacity. And even though the information in the records is mine, I still ran across staff that were resistant. They were resistant to sharing those records, and it's only because I am such a persistent individual that I didn't give up. But it's been incredibly frustrating.
All the patients assumed that everybody they saw in the medical system knew exactly what had been gone on to them, what their lab work was, who they'd seen, what their problems and their allergies. And I think even as a provider, you assumed when you sent off the information that it would make it to the right person and they would know what your patient was there for. And you'd hear the stories come back and recognize, ooh, that was not a good journey, or that was not a great outcome, or that could have gone smoother. But as you dig into all the data stuff, it's like, oh, because nobody actually has the pieces. Everybody's got their little siloed piece.
I really put in the work to make sure that my children's health did not suffer as a result of a system that was often not well coordinated.
I think the open standard approach means a lot of the disconnect that we have right now is that they don't talk to each other. If from one standard now, if everything has to meet those standards, then when you go from health authority to health authority, from provincial to local, from leave the province, in a beautiful world, they would meet your standards coming back. But I think it's just talking the same language. Right? We're not.
And there is a way to better care, and that is to enable patients to truly be partners in their care by having real-time access to their records, and for the doctors to be prepared for the reality that patients will come with lots of questions. That's a good thing. That's not a bad thing. Physicians can then have a real conversation with the patient whereby the questions, some of which may come out of left field, but reveal what actually matters to the patient. And really only then can the doctor take the medical knowledge that they have and blend it with the human being in front of them.
Such a complex situation with so many players and standards and things that have to be met and costs. We can start simple and then say there's lots of ideals and there's lots of features that may eventually be amazing. But by starting simply and seeing, okay, what makes sense in each rural context? What's the most important? What's practical? What can we do? What can we put in place to really support patients without tipping that balance and having unintended harm to the healthcare providers? How can we work our way through this and not just have a pre-made box dumped on and say, work with it, without a lot of flexibility, and then you tend to get these defensive positions and people's worried. Whereas if we can start simple, say, okay, this is what we got. What else can we do?
There is a way to better care, and that is to enable patients to truly be partners in their care